This month, we're talking about ways that we can improve our longevity, particularly from the standpoint of the way we move and the way we train. Now, first up on that list is going to be strength training, but don't worry, cardiovascular training is coming too, and we'll kind of dive into the specifics of why both of those are very important in this process, but they do serve different purposes. Hi, I'm Dr. Zach Ralliff at TruMotion Therapy here in Charlotte, North Carolina. We specialize in the conservative management of musculoskeletal pain and injuries, meaning our treatments don't entail the use of surgery, drugs, or long-term care plans. Now, some of you might be thinking, what is the importance of training for longevity? And the primary reason for that is the difference between lifespan and health span. Now, lifespan is going to be the number of years that we live. Health span is going to be the quality of those years. Now, the difference lies there in most Western society, or Americans in particular. We are living well into our 70s, which is incredible. But unfortunately, for many of us, the health or that decline into older age is starting earlier. Now, we want to be aging well and have as much movement capability for as long as possible. But unfortunately, many of us, our last decade of life, or even sometimes last couple decades of life, we're severely limited in our abilities and activities. So the purpose of training for longevity is to shorten that gap and enjoy more years of our lives. Now, let's start off with answering the question of why is strength training important? There's gonna be a couple aspects to this, one being the metabolic side of it, and the other going to be the physical aspect of it. So from the metabolic side, we want to increase lean muscle mass so that we have more tissue in our body that is utilizing and burning calories. This is going to help with weight management, as well as increasing our insulin sensitivity. So it's going to do a better job of keeping our blood sugar in check, which will have many more benefits down the line that we'll explain. Now, the other aspect of this is going to be the physical aspect of this. So again, back to it's our best way to increase lean muscle mass. Now, this isn't muscle mass that's going to make you bulky, but it is muscle mass that is going to allow us strength to do activities that are important and meaningful to us, as well as things like stimulating increased bone density and decreasing our fall risk as we get older. Now, let's talk about some strategies for how we can go about strength training. Now, this could be in the form of body weight exercises, it could be using machines in the gym, it could be using free weights. The important aspect of this is that it is resistance-based and often in a weight-bearing setting. Because remember, the specific thing that we're trying to target with strength training is adding to that lean muscle mass. So certain things like spin bike workouts or things like yoga it's not going to give our tissues enough resistance, enough stress to create more lean muscle mass. Now, those things totally have their time and place for different aspects that we'll talk about, but it also kind of paints the picture of why we need a broader base of fitness to train different aspects in terms of how that will affect our longevity. Remember that we want to increase lean muscle mass so that we have strength for our lifetime. Now, this is also a good time to talk about how our lean muscle mass does start to decrease as we age. So as we get older, we do start to lose muscle mass each year at a very small percentage, but it does begin to fall. And if we're not actively trying to add more lean muscle mass to our system, we're not gonna have as much of a cushion to kind of soften that decline as we age. Now, another important part I like to bring into this is the need to train over the capacity that you need. So say that you need to be able to carry your 20-pound toddler. Now, 20 pounds to you now in your 30s or 40s doesn't seem like that much, but what we just talked about, when that lean muscle mass does start to gradually decline, we need to be able to still lift 20, 30 pounds later in life. But if we can't lift 50, 60, 70 pounds now, we're not going to be able to lift that 20 pounds later in life. Now, the last point I want to bring up is that it's never too late to begin this process. We can always add more lean muscle mass. We do know that the earlier you start, the better off we're going to be. So start as soon as you can, but it's never too late to begin that process. So whether you're in your 50s, 60s, 70s, it's still going to be a good thing to put into practice so that we can maximize the years that we do have left. Now, if there are things that are affecting your ability to do strength training, whether that be pain, previous injuries, joint stiffness, anything like that, that's where we come in to help. So I would invite you to check out our website at TruMotionTherapy.com, where we have more resources, more videos, as well as the ability to schedule an appointment with one of our providers. And we would love to work with you to eliminate any of those barriers and to be a guide along the way to help you add to your strength training and many of the other topics that we're going to discuss this month. So check that out, and I hope this video has been helpful and that you've learned a few things to take away.